Anybody else? Well, thank you very much. Our elected officials are all extremely busy people, and it's great to have them here to learn along with us about this important topic. Well, we are here tonight to learn and educate ourselves about how one state, New Mexico, created a medical cannabis program that effectively helps patients and families. The program helps patients that have chronic and debilitating medical conditions and chronic pain to effectively manage those conditions where conventional medicines and treatments have failed. We're also here tonight to hear several personal stories from Iowans that suffer or have family members that suffer from chronic and severe health conditions. We will learn how they have managed with medical cannabis or how they wish they could without fear of breaking the law or getting a criminal record. Tonight is about having a discussion about how we can organize an Iowa program that provides safe, legal, and controlled access to medical cannabis to help Iowans with serious problems. Tonight is not about legalization, it's not about recreational use, it's not about the war on drugs or sentencing reform. Well, these are all really important topics that need debate and considerable attention. They are not the subject of tonight's discussion. Rather, our focus tonight is on a discussion of how we can organize a program that provides safe, legal, and controlled access to medical cannabis to those Iowans that are suffering. Before we hear from our special guest tonight, I would like to do a brief review of recent legislative history and work on this issue in our state. In 2009 and 2010, the Iowa Pharmacy Board did an exhaustive study and review of the medical literature on cannabis. The questions they asked were these. Is cannabis effective as a medicine for certain chronic health conditions? And is it possible to establish a program that would provide legal and controlled access to cannabis for patients with certain medical conditions? They conducted a series of four public hearings around the state to gather input from patients, law enforcement, the medical community, and interested citizens. And with the help of medical experts, they did a thorough review of all the scientific literature that was available. At the end of this study period, the board unanimously concluded, based on science, that cannabis indeed does have medical benefits for patients. And they also recommended that Iowa should create a program modeled after New Mexico to provide patients with legal and safe access to cannabis. I got my slides out of order. Here we go. The discussion and debate in Iowa is happening across the country, where 20 states, the states on the slide, have decided to create medical cannabis programs. It's interesting to note that in the first seven states that medical cannabis laws were enacted, it happened by citizen referendum. However, in the last 7 states where programs have been established, they have been created by bipartisan action of legislatures and governors. At the State House here in Iowa, there have been a number of bills introduced over the past few years without success. There have been several public hearings at the State House on those bills. Many people have provided supporting testimony. There's also been opposition to the bills. Next month, 2 bills will be introduced in the Iowa General Assembly, one to reschedule marijuana from Schedule 1 to Schedule 2. This would essentially classify marijuana as medicine. The second bill would create a program for patients modeled after the New Mexico medical cannabis program. For any issue that comes before the legislature, there's an educational process that must take place. Iowa legislators have not heard very much from their constituents about this issue. So to start the evening, I have a question for all of you. Let's see a show of hands of all the people who know who your legislators are. All right, a lot of hands, good job. For those of you that didn't raise your hands, you don't know nothing, all right? Here are the basics. You have, everybody, if you live in Iowa, you have one of each. You have 1 state senator and 1 state representative, 1 of each. And if you want some action on this issue or any other thing you care about, you need to figure out who's representing you. If you don't know who your legislators are, your county auditor can tell you. You can call down to the county, or you can go to the state legislature's website, type your address in, and it'll tell you who your legislator's on. Once you figure out who they are, you need to make contact with them. And I just say, this is not DC, this is Iowa. Your legislators want to know what you think. They really want to hear from you. And of course, we also have the executive branch. The governor also wants to hear from us on this issue. So before we hear from our speakers, final piece of business, and then we'll hear from Dr. Jenison, I'd like to let people know that on the back tables as you came in and signed in, there are cards back there with some pens, and we're going to do some question and answer after the presentations. And I'd like you to, if you have a question, to feel free to provide it on the cards, and there's Rusty's handing out some cards in the medium aisle there. So let's get started. Dr. Steve Jenison was born in Ames. He graduated from Iowa State University and earned a medical degree from the University of Iowa College of Medicine. He received the University of Iowa College of Medicine Distinguished Alumni Award for his service around the issue of developing a rapid diagnosis test for a hantavirus outbreak in 1993. Dr. Jenison served as the first medical director that oversaw the implementation of the New Mexico Medical Cannabis Program, and also served as the first medical advisory chair to that program. This month, Dr. Jenison is back in Iowa studying emergency medical care at the University of Iowa College of Medicine. He is kind of semi-retiring to rural New Mexico, where he plans to continue his medical work as a voluntary EMT. It's probably safe to say that Dr. Jenison knows more about medical cannabis than any other native Iowan. We are pleased to have him share his expertise and experience with patients and the effective program he oversaw. So please join me in welcoming Dr. Jenison.